So, hey guys, first and foremost, we COVID test. So we know that we're COVID negative. So we're going to remove the mask. Today, I like to talk about being mature. I don't like to say aging because it just feels better for me to say that as people we mature. If you don't mature, if you don't age, you die. So there's no real thing in anti-aging. You cannot block aging. You're going to age or you're going to die. But I do believe you can manage aging. And how do you manage aging? It's a whole plethora of things, but most importantly, you are what you eat. So your diet is extremely important. So if you're eating a bunch of sugar and you're eating junk food, processed foods, then you're gonna age because of the acidity that your body is under. And then exercise. You know, your heart is like the engine of your car. If you don't run your car, then you're gonna clog up those pipes. So you have to exercise. 75% of weight loss, so is your diet. And then mind is extremely important. But today I wanted to talk to you guys about something that if you don't want to do it, it's okay. Don't write me the bad stuff, but anti-aging with Botox. You don't want to look like you're aging, so you want to manage it. So today I have Dawn with me. Dawn's a nurse practitioner and she does all of my Botox, all of my fillers. And we're going to talk about Botox because both of us need it in certain areas.
Yeah.
See these little crow's feet right here? There's little wrinkles. I don't want that there. And I wanted Dawn to, of course, inject my crow's feet so that you don't see them. Now, I've already had Botox about a month ago, so I look real nice and smooth. But I get my little 11s here. Go look in the mirror. Yeah. I bet you have some 11s.
If you go in, kind of like these, this movement will kind of take away.
Right. And so a lot of us get those frown lines and they get so deep in some women and men that they create a permanent frown line and you have to go beyond the Botox. But today we're going to do Botox.
Yeah.
So we're going to Botox Dawn's frown lines, get rid of those. And we're going to Botox her 11s. You got any crow's feet there?
Not much.
Okay. All right, so I have the crow's feet, but you can use Botox. And so first of all, Botox is a neuromodulator that you inject in certain places to paralyze the muscle. And go back and read your research on Botox. And in using small doses like we use it, you're not going to harm the person. And if you know how to inject, you're not going to harm the person. But in every procedure, there may be some side effects. So it can be used on your face. It can be used around your eyes. We don't put Botox here. These are actually fillers that you would need here.
Right.
Because we don't want to talk like that. So, and then Botox is used for migraines. It's used for pelvic pain. So there are a lot of things you can use. But today, we are anti-aging.
Yes.
And so we use, of course, products. There are different types of, we all call them Botox, but there are different types of neuromodulators that you can use. Then we use an ultra fine needle. You can barely see this needle. Obviously, everything has to be semi-sterile and that you clean the face with alcohol and you inject. Now you gotta know how to inject, whether you go really, really deep into the muscles like we do right here, and you almost hear like that little crunch feel.
So anatomy is definitely a big thing with Botox. Knowing where to inject and how deep to go is definitely key to successful results.
And so today, we're gonna show you Botox 101. You're first.
Okay.
So what I am going to do is make sure Dawn has signed a consent giving me permission to give her Botox and that she understands the side effects to the Botox.
Yes.
So you always want to know your risk and your benefits of anything you do in life.
So some of the risks associated with the Botox, obviously if you're pregnant, breastfeeding, it's not advised that you get the Botox. As far as side effects, there's like redness at the area once injected, sometimes a little bump or swollen area.
Like a little wheal.
Right, but that will definitely go away within an hour or two post-injection once we're all done.
Some of the other instructions is once you get your Botox, don't go and lie flat. We don't want the neurotoxin to travel up the face or travel somewhere. So you have to stay sitting up for at least
4 to 6 hours.
4 to 6? For at least 4 to 6 hours.
No hard working, no workout for sure. We don't want you sweating it out. No saunas, no pool, nothing like that. So don't leave here and go out and think you can conquer the world.
Okay? Now, determining the dose that you need is really based on your training. You've been kind of trained to say, she may need 1 unit here, 2 units there, whether you need. So when you hear them calculate your cost, it's based on they calculated 2, 4, 6, 8, 10, 12, you know, and the more aging you have, the more units you will need.
Right. And it also depends on muscle movement, how strong that muscle is.
So give us a frown and give us a see.
So raise the forehead is one of the motions you'll ask patients. So they'll go up and then you'll see
these lines. Now she doesn't have really big lines, but she's got lines.
Right.
And then if you see when she frowns, you see these muscles, how they contract in here.
So you just smooth those out.
You want to just keep that motion from happening so you don't see now, you don't want to freeze the face.
No, do not.
So please don't get it overdone. Like you don't want to go in and come up looking like Frankenstein. You still want to have some motion. Like I can still move my face. I didn't raise my eyebrows way up in the air. It looks just natural.
Right. So the goal is for a natural look. You can still move the muscles, but no creasing or lines are being formed. That's truly the goal. Males and females can get this, so no one is excluded.
Right. And no race is more prone to wrinkles than others. Now, if you're in the sun and you're not wearing your sunscreen and you're not taking care of your skin, you're more likely to wrinkle. So with Dawn, we're going to clean her face first. We're going to try not to get this alcohol in her eyes, okay? And then we're just going to have her take a mirror and she's going to see exactly. Now, she doesn't have the crow's feet. I do. And so we won't have to tap into here at all. Now, we didn't wear makeup today, so you can see the rawness, okay?
So when I raise up, I don't like these lines, so can we take care of that? And then when I make an angry face, can we also take care of this?
So you want to manage expectations. You don't want the patient to walk out thinking that she's going to come out with, if it's fillers, these big old lips, or the lines are going to go 100%. You want to still look human. This is for softening the aging process or managing the aging, not to get rid of it. So Dawn is going to, let me come to that side of the table because I can't work on the left side.
Yes, ma'am.
Okay? All right, so I'm going to, I'm going to put that, whoa, your pencil is raggedy. Or did I just stab you real hard?
It's fine.
And right here. So we want to paralyze these two muscles. You see it?
Yeah. Okay. So also everyone anatomy is a little different. Typically you do 5 spots, but in my situation I definitely don't need 5 spots, but essentially we'll do 1, 2 out here in the corrugator and 1 in the procerus, and then repeat the same thing on the other side.
Okay. I'm going to pull up the last syringe for Dawn's Botox, and again, she still has great skin, great muscles, and so remember it's an ultra fine needle. My last syringe is just to kind of tilt it to the side. And there we are. I'm gonna put back because every drop of this counts. It costs us per unit. All right, and so here we are. She's gonna get 5 units in one of these main areas. Don't want to bend that needle, guys, so be very cautious that you're not bending the needle, okay? Now, this is some very valuable stuff, so make sure you put the top back on there. You got a booty. It's turning, okay. Boom. See how simple? She didn't even flinch. Did it hurt?
Just a little prick and then that's
Okay.
it.
All right.
So essentially you're trying to push the Botox where you want it to go, and never push down. You always want to push up and out.
Okay.
So we'll stay up high, because typically if you go too low, you can drop someone's forehead and we cannot fix that. So
until it wears off.
Right, 3 months.
Yeah.
So you stay up high.
Angry. massaging up again.
So no bleeding or anything, but a lot of patients tend to bleed if they are on blood thinners or Motrin, Aleve, or even like wine the night before. They can definitely bleed and have an increased risk for bruising.
Okay, so
we
now
advise
Dawn's gonna look 10 years younger in a few days.
In 7 days.
No, mine was almost in 2.
See, she got the good whatever is in there.
All right, so now we're gonna turn the hand over to Dawn, and she's gonna fix these crow's feet. You see this little stuff I got going on right here? I call this managing aging. You cannot anti-age unless you're dead. And so we're gonna manage my aging. Okay. Now I'm not as good of a patient as Dawn. I mentally get myself psyched up for this, so I don't do it often until it gets really bad and like I'm looking like I've been out in the sun. So
Smile really big. Ready?
As ready as I'm gonna get.
All right. Poke.
Goodbye, Bray.
We ain't got it.
And if you notice Dawn's tapping on the face, the tapping will distract the pain.
And done.
All right. All right. And this is another way of distracting the pain receptors, is that you just vibrate here. You really need to put it in the area you're gonna get it in, but see, I didn't even feel that. All right. Ta-da! And there we are. Crow's feet, be gone. So that again is part of the beauty regimen for a lot of people. I don't want to say just women, but it is important that you manage aging as you see fit, but never forget part of aging is diet, exercise, it's mentality, but the few things you can add could be Botox and fillers.